Greetings, I'm Dike Rostant. Welcome back to the TTT News. I think I'm going through this entire conversation that we're about to begin humming both Grandma's Hands by Bill Withers and Sheldon Blackman's Blessed Are the Elders. It is time to go in depth on enhancing the quality of life for older persons with Director, Division of Aging, Ministry of Social Development and Family Services, Dr. Hyacinth Blake. Welcome, Dr. Blake. How are you doing?
I'm quite good, thank you, especially with such great music choices that you pulled out there.
Thank you so much. The things that I think about all the time and go through because I have a granny that I love, Granny from Maruga, the one who used to kind of grate nutmeg in the Vicks, make the Vicks ever so much stronger. I'm missing bush part has been the longest. Well, I'm not sure I could fit in the basin, the enamel basin anyhow. But enough about me. I want to start off though asking about the role of the Division of Aging.
Sure, I just had to touch on that point about Maruga, so I'm going to shout out my grandmother, who probably lives next door to yours. Hi, Mommy Rampastad, Polly Rampastad. So yes, back to your point about the role of the Division of Aging. It is to have that intergenerational connection that you just mentioned. A little bit of bush bad, though, I mightn't do that myself, but basically to build relationship with our older persons, to honor them, to appreciate them. As a division, our mandate is to be the hub for programs, policies, and initiatives within the Ministry of Social Development and Family Services for our senior citizens. So we have various initiatives that I'm going to be happy to tell you about throughout this conversation.
All right, and we hope to get through as many of them as possible. But in terms of those priority areas that the unit seeks to address, what are some of those?
So public awareness is one of the key activities that we're involved in as part of ensuring that our elders are treated well, that they are integrated into our society, that we address issues of elder abuse, first through sensitization and of course through policies and other interventions. We do, of course, address issues of training. We provide services in terms of care for persons with residential needs, and we are engaged in research as well. So investigations of elder abuse, promoting positive views and thoughts and ideas about our elders. These are some of the things that we are focused on.
And you say research, and then after that you spoke about investigating elder abuse. But what are some of those things that you'd be researching?
So we have an older persons information center, for instance, and we do receive information requests from the public, from various spheres of society, students, persons who want information on care facilities for older persons, information on government programs, civil society services that they can access. So it is a referral service that links older persons to various initiatives that are provided throughout the society. But back to the question about research, we do track and monitor through the OPIC the types of calls that we get when it comes to even complaints about elder abuse, the different types, be it physical, mental, verbal, and so on. And we do look at the international literature. We try to collate information locally as to what's happening with our senior citizens. So that's the type of research that we're engaged in, and of course to inform policy development.
And speaking about the elders, our older citizens, Dr. Blake, where does that catchment area begin from? Because 4 is older than 2. But in terms of like saying, okay, well, this is the target grouping that you are here to facilitate things for, what does that grouping look like?
So we primarily focus on persons 60 years of age and older, using the international definition of an older person. However, there are programs where we do address the needs of persons 55 years and over. So the community care program, for example, is an initiative that this division coordinates in collaboration with the Ministry of Health, and that pertains to older persons who are medically discharged from hospital, but they require help and care within the community, and usually they are unable to afford that themselves. So, we hear these unfortunate stories about elders being abandoned, be it during the carnival season, which is a big no-no, or they don't have relatives here, and there are many persons, because of the pandemic, they do not have that kind of family support. So the most vulnerable of them, we do engage with our partners at Ministry of Health and provide care within residential facilities. So that's one of the ways that we meet the needs of our elders.
Thank you so much for that. And you preempted a question, or we on the same wavelength in terms of the work of the division during the pandemic? Do you find that as something that has changed? What are some of the things that are new or ways that you need to address concerns in a little different manner?
So because of the pandemic and our need to keep our elders safe, we have to minimize our engagement face to face with our elders, but at the same time, we want to encourage them to utilize the digital environment. Now, we've had various projects through our hashtag Halo, for instance, in commemoration of the United Nations International Day of Older Persons, for which the theme, sorry, for last year would have been digital equity for all ages. So we encourage our seniors and their caregivers to, use cell phones, use tablets to stay in touch, stay connected, even though we're being physically distant, and to learn and access services through that mean. However, of course, we know that not all persons will be tech savvy, so we still have our 800 OPIC number that persons can call toll free, 800 OPIC or 800-6742 to access services, be it information on the various services within the government sector and otherwise.
And that relationship that you're speaking about, and it's something that the Minister of Health would have been talking about in great detail in terms of long stay homes. What is the relationship between the division and the long stay homes?
Right. So one of the key roles of the ministry, going back to that question, has to do with formulation or advocating for the formulation of legislation and getting engaged with that. So there is the Homes for Older Persons Act 2007 that is yet to be proclaimed. So in the meantime, you find that the Private Hospitals Act of 1960 is in operation with regards to residential care facilities. So one of the key activities of the division is to establish standards of care. And because currently Ministry of Health is the lead for that, we support them in terms of inspections of homes until such time that the legislation is enacted. So we have been making great headways in pressing on with that legislation because it was in 2007 that it was developed, and we're trying to bring it up to speed to recognize the current element as to what's happening in the policy environment with our elders. So for instance, things like the licensing fee, things like whether or not there needs to be liability insurance, we're addressing that more pointedly in terms of the quantum and other elements of the legislation. But basically, we do collaborated visits to these facilities to address issues of quality of care for our older persons and to ensure that they are being kept safe. For the most part, our interventions tend to be in person in a limited way because of the pandemic. So we prioritize accordingly. We do use our triage approach, and we do some live verification, for example, with our community care clients online through our databases and contact with their caregivers.
And thank you so much for that. And I want to get into the topic of interventions. When we return from the break rather, we're speaking with Dr. Hyacinth Blake about definitely treating our older members of society with the care and value that they deserve. Stay with us. We'll return with more. Welcome back. We are speaking with Dr. Hyacinth Blake, Director at the Division of Aging. And Dr. Blake, you gave us numbers in terms of 623-2608 as well as 800 OPIC 6742. Now, if things are not as they should be at a home, or there is a situation where someone, an onlooker seeing an intervention is needed, what are the steps? Please carry us through the steps in the progressions of the process.
So once the division is contacted either via our toll-free number, as you just indicated, or they can also opt to email us at opic@social.gov.tt. We use a ticketing system online, and that case, according to the area, would be assigned to an inspector. The inspector will then, depending on the nature of the case, do an initial set of interviews with the persons identified. Please note, however, that if the informant wants to remain anonymous, we do respect that, and their name will not be placed in any of our reports. They'll be noted as anonymous. So we would, based on the initial findings from calls and depending on the situation and actual visit, we would engage with the TTPS, who may have right of entry for us to visit a facility, the public health inspectors, if it is a facility. If it is the private residence of an older person, We engage the gender-based domestic violence unit, and we may also engage the district health visitors, and we do a visit to assess the situation and make relevant recommendations. So we also refer to the various entities within the Ministry of Social Development and other state partners as well. So for instance, the Ministry of Youth and National Development, currently the Retired Adolescent Partnership Program is there, as well as the Geriatric Adolescent Partnership Program. So we do make recommendation for caregivers to be provided or listing so that those services can be provided within private residences. So these are some of the ways that we engage with our stakeholders and state partners. We also have a lot coming up for those of our elders who have lived past 100 years of age. So the National Centenarian Program is going to be a big part of what the division is doing throughout this year.
And what will that program look like?
So we started off with launching our National Centenarian Registry on the 13th of December last year. So we're encouraging persons who are about to turn 100 years of age, those who are 99 years of age, to register on the ministry's website and various social media platforms at www.social.gov.tt if you would like us to honor your centenarian. So some of the benefits of signing up for this program include you will receive tokens. We have partnered and we have the support of Kiss Baking Company, which is a platinum sponsor of this initiative. So those who register will receive a Kiss birthday cake from the program, as well as a certificate signed by our Honorable Minister and members of the executive. And those frames, we have some frames from another donor, Eastern Styles Limited, who we want to just acknowledge. Thank you for your contributions. And anybody who would want to contact the ministry to participate in this program, feel free to contact us using the information mentioned before. I'll repeat it at the end. Now, in addition to commemorating birthdays, and it would be limited in terms of in-person visits because of the pandemic, but we will make a few visits following the COVID-19 protocols. And throughout the year, we will have events, be it during National Family Month, when we will have seminars for caregivers because we know they are critical to the longevity of our older persons, or the family caregiver, in particular, and other caregivers who may be paid and providing support. In June, when we are celebrating World Elder Abuse Awareness Day, we will be doing financial seminars to assist with end-of-life planning, and we would be commemorating our centenarians in a recognition ceremony on the 22nd of September, recalling that National Centenarians Day. And quick point about that, Trinidad and Tobago will be an independent nation during National Patriotic Month as a 60-year-old nation state. So all the more reason to have a National Centenarian program at this time. And there will be other things that we are doing. For instance, for World Health Day in April, we are partnering with Ministry of Health, who we just want to commend for their continued support to make our centenarians, our VIPs, our fast-track clients to get their basic vital checks and so on as a priority.
And I appreciate the amount of stakeholders that you would have listed. If there is an NGO, a group, an outfit, an individual who wants to be part, who wants to engage with the division, possibly share resources, because many hands make a lighter burden. How do they do that? And what are some of those things that you're looking for in potential stakeholders?
So we would want to honor our senior citizens, our centenarians, even amidst this pandemic, because they've contributed so much to national development. So we have actually written to schools, universities where there are photography students. We're encouraging photography students to provide their services to our centenarians. You can contact us and let us know if you're willing to do this for us so that we can commemorate them virtually and include their picture in, for instance, our virtual magazine that we will also be highlighting throughout this year. It will be published primarily around United Nations International Day of Older Persons in October. But from all now, we would want to get their pictures as we make our visits, our limited visits accordingly. We would ask persons if they would want to contribute to the care hampers that we are preparing for our elders, if they can contact us as well. So do call us and let us know you want to be part of the National Centenarian Program or any other initiative of the division. When we advertise our hashtag Halo and these other activities, you can contact us at 800-6742 or via email at opic@social.gov.tt.
This is a raft of initiatives that you're talking about, Dr. Blake. And one of the things at the beginning of the conversation, we looked, or you itemized that intergenerational engagement. Even though COVID a keep, what is the significance and the importance of having older individuals speak with younger ones, getting to know each other, having those sorts of conversations? What's the importance of that?
Well, I believe that our elders is part of that big jigsaw puzzle of life, and they have solutions, and we must not give away that missing piece because we will not have a full picture as to what life is about. And in these times when we're going through the difficulties of the pandemic, they are our symbols of hope, that there is longevity, that there's something good happening in this nation that allows for healthy living and long life. So, we look for the fountain of youth in all these movies. They are basically, they have that key, that they have that solution in terms of how can we live well and live long. And even if there were mistakes along the way, they can teach us and we can learn from them in reverse. So that intergenerational connectivity is important to capture the lessons that they would have learned across the lifetime that they would have had. And those coping strategies can help us, especially at this time. And then there's this issue of the generational gap. We would want our younger persons as well, and persons of all ages, to share the current knowledge that they have. I mentioned technology earlier. Many of our elders have been left behind, or some are better than me when it comes to the technology. But we would want our younger ones who have been born into this digital age to be able to share their knowledge and insights as well. So this is supposed to be a society of all ages, and this is why we need to address it. And it also reduces things like elder abuse. And counteracts things like ageism, because all of us would like to live, I believe, a long and a good life. And part of that is being in good health, but also having social connections. And so we would want that for ourselves, so we should give it forward now.
And is that a thrust of the division in terms of the research that you're doing, trying to get some of these stories, trying to get some of that information, the coping strategies? Because it's said when an older person passes, a library burns to the ground. So is that one of the things that you're
Exactly.
thinking about eventually, if not already?
Yes. Yes, it is. So as part of even our National Centenarian program, we will be capturing the stories of our most senior persons. There's what they would have done, what we can learn from them. We will be speaking to the oldest male, the oldest female in Trinidad and Tobago, and we will be publishing stories of their life on our website, and also, highlight some of their stories in the newspaper. So that is something that we would want to do because we need to preserve that kind of legacy. Look at Tanti Lou says, and how she would have started doing sports in her later life and done so well at it. I mean, when you would have seen these stories about what she would have achieved and how she would have gone about it, that's something to inspire us. I think she passed me sometime on Chancellor Hill. So these are some of the things that we want to capture. We
You
want to
laughing
learn
like saying
about.
if Granny Lucy's ever passed me in a race, I instantly pull in a hamstring or something. I done.
I don't keep on
I'm
trying
out.
to race.
But we want to thank you
So
so much,
yeah.
Dr. Blake, Dr. Hyacinth Blake, Director, Division of Aging, Ministry of Social Development and Family Services, and really speaking to enhancing the quality of life for older persons. And on behalf of the entire TTT News team, I'm Dike Rostant. Thank you so much for joining us.